Hi, my name is Marquand. I'm chairing this session today for OHBM. It's charting variability in health and disease using normative models. I'm going to give you quite a conceptual talk at the beginning, which is entitled Shifting the Focus from the Group to the Individual. So what I'm going to talk about effectively is three things. I'm going to give you a little bit of conceptual background to normative modeling. I will talk about approaches from ourselves and others for using this approach to chart variation across the lifespan. And last, I'd just like to give you an illustration for some of the inferences that we can make on the basis of these models. And I hope this will pave the way for the talks in the remainder of this session. So the classical starting point for understanding normative modeling is as a generalization of pediatric growth charts, which aim to plot biological parameters such as height or weight as a function of, for example, age. So what we do in normative modeling is we translate these things for variables that are relative to, that are of relevance in brain disorders, and they can be mappings between demographics like age and sex and biology. But effectively, we can choose any variables we like for this kind of mapping, so genetics, cognitive scores, symptoms, etc. By doing this at effectively every sample brain location, we can generate some kind of multivariate mapping that describes how these changes are reflected in biology. And of course, the purpose, one of the key features of normative modeling is that we can make subject level predictions on the basis of the centiles of variation that we learn from a large data cohort. And this provides a really, I would say, an ideal platform for stratifying conditions, for example, on the basis of these mappings. So some work that we've produced recently, you can come and look at this work from Sage Rutherford, who's really been championing this area. And she aggregated a very large data set to generate a growth chart for the brain, if you like, a fairly comprehensive reference model for cortical thickness, subcortical volume, and so forth. And this is really one of the really nice features of this approach, is that we can use it for data that are not part of the training set, and it's really important. So we can recalibrate the normative model to give us predictions for unseen data. And we think it's really important to do this on unseen held-up data so that we get unbiased estimates of the centiles in the new data cohort. Of course, there are other approaches that have done a similar thing. I'm showing you a couple of them here. But one I would really like to highlight, it's been somewhat overlooked in the field, is this paper by Gabriel Ziegler, who was almost a decade ago, using this model at the voxel level, this kind of normative modeling approach at the voxel level to understand individual variation in, for example, dementia. And I think it's really, these models really come into their own when we can really get down to fine-grained patterns of atypicality, use them to understand individual variation at a high spatial resolution. So one of the things that normative modeling is quite useful for, and this is probably the most straightforward benefit of normative modeling, I would say, it is quite often used for focusing group differences. So I'm showing you a set of data here. Now, if we were to plot a marginal distribution for these data points, you might end up with something like that, which has a certain distribution. So what we're doing in normative modeling, when we fit a normative model, is you can think of it as reparameterizing the data in terms of from moving from raw values to estimated centiles within the population. Now, the benefit of this approach is that effectively focuses the differences, because we're understanding differences with respect to population centiles, and we can account for all this variation, potentially non-linear variation across the cohort, and it provides us with more sensitive inferences. And again, this is work from Sage Rutherford that shows this quite clearly across a number of different disorders. We see a substantial increase in the magnitude of the effects relative to the raw data. And this is an important feature of normative modeling. So it can, it's not the same. It's important to point out that it's not the same as correcting for group differences, because we're really using this large population-based sample to really get good estimates of expected variation within the population. That said, I would say that this is, while this is important, it's probably not the most interesting aspect of normative modeling. So what we can do with normative models is we can break the symmetry in group comparisons. So for example, I'm showing you a hypothetical data set. If we abstract away from the details, what we might do in something like a case control setting, for example, a classifier or a t-test, is we're effectively testing differences between group means. And you can see in this case, while the mean of the reference cohort is meaningful, if there is heterogeneity within the clinical group, then the mean of this distribution is not reflected, not accurately reflective of any of the subgroups that we might have. So it's in this case it would be a meaningless comparison. And again, this is shown by some of the work that Sage produced earlier this year. And really the key feature of normative modelling that enables us to sort of break through this deadlock is the moving from group level inferences to individual level inferences, which is really important for understanding heterogeneity. You can have a look at, we have a poster using this approach to predict outcome in first episode psychosis. This is Amanda Worker, who's leading on this work, so you can come and visit to have a look at a clinical application in this domain. I'm just going to summarise. So this is we've now demonstrated this symmetry breaking, the value of this in a number of different disorders, and I'm showing you now work from Thomas Wolfers and Mariam Zabihi across a number of different disorders. On the left, I'm going to show you the classical group differences, and on the right, the individual deviations. So in, for example, schizophrenia, bipolar disorder, ADHD, and autism, we see either substantial group differences in the case of schizophrenia, or very few in the case of autism, and something in between for the other disorders. And on the right hand side, I'm showing you the overlap at the voxel level for the number of individuals that have an extreme deviation in this particular region, and it's thresholded at 2% here, and this is effectively the number of subjects having extreme deviations. And you can see that that gives you complementary information. So even in this case, we have robust group differences, very little overlap. Here we have no group differences, very little overlap. And you might think, well, this is a truism. We're always going to see that. That's not the case. So in something like dementia, for example, we get up to 25% overlap in the medial temporal lobe. So it provides us a way to really quantify the individual variability within these conditions. We can also use this approach for generating biomarkers. I'm showing here work from Mariam Zabihi, again, Natalie Holtz, and Charlotte Fraser. So Mariam used this approach to generate putative biotypes for autism, using a clustering algorithm trained on the basis of the normative modelling deviations. And this is quite interesting because we see that there are both increases and decreases in cortical thickness, which cancel out, and that effectively explains why we don't see any group differences in this cohort. We could think about, for example, doing some kind of matrix factorization to try to find latent dimensions in the data, so that would be overlapping profiles. And we could also use something like extreme value statistics to get some kind of risk score from a set of normative models. And you can take a look at this poster for more details about that if you're interested. So another feature of normative modelling that I think is quite interesting is we can use it to bind different sorts of data together. So I'm showing you here, so for example, you're interested in a normative model of the left lateral ventricle. You can see that we have units in milliliters here. And what we do in normative modelling is we map from raw values, which might have some strange distribution to population centiles. And if we do a good job in the normative modelling, that might move from a skewed distribution to something that's symmetric and close to Gaussian. If we were then interested in combining these data with something like cortical thickness, you can see that this is in a totally different scale, so it's quite difficult to meaningfully compare these without doing some kind of transformation. So what normative modelling does is we have comparable values across all the different things we're interested in. So nice, well-calibrated Z statistics that are good for future analysis. So something else that we can do is we have a, supposing we were comparing these different groups in this cartoon illustration, that would be quite difficult because you can see the distribution is really different between the two. So we could do a meaningful comparison between these in terms of the expected centiles with respect to the reference model. We could also, we might in a different context be interested in doing some kind of longitudinal analysis. So we're comparing these things that might be acquired at very different times, perhaps on different scanners. And so that's the focus of this work, which you can check out in this poster. And Pierre Berthet is leading on this work, where we use hierarchical Bayesian regression to do meaningful comparisons across things that are acquired on completely different scanners. And you can see that the histograms on the left, on the right hand side, are the raw data that are corrupted with site effects, and that's all taken care of by this normative modelling approach. Another thing that is these things become really useful for. Okay, so I've given you a really sort of brief overview of the kinds of inferences that we can perform with normative models. It provides us a platform for understanding individual variation. It provides us the opportunity to make use of big data cohorts to bind them together and to map variation across the lifespan. And shifting focus from the group to the individual opens the door to many new inferences that we can think about making inferences about individuals with respect to a common reference model. We can detect longitudinal changes, and it provides us a platform to bind different studies together. I would just like to thank all the people that actually did the work and the funders of this work, and just also invite you to come and visit some of our work that we'll be displaying here at OHBM. And thank you all for your attention.